Wake County was recently ranked the healthiest county in North Carolina overall for the 4th year in a row. Human Services Director Ramon Rajano is here with us now to talk more about the programs and the ways of serving the community that make this distinction possible. Thank you for being with us, Ramon.
Thank you for the invite, Sarah, and congratulations on a great show that you run here.
Let's start with the healthiest county ranking overall. What group did this come from, and how do they make these determinations?
Well, the whole organizations in public health in the country for several years have been looking at ways that you could develop a scorecard so everybody understands what the indicators are. And then the University of Wisconsin, with money from the Robert Wood Johnson Foundation and other governmental entities, joined together and developed the health rankings that measure 30 different categories of health and divided in 5 different groups. But something very important to know is that when they talk health, they define health in the broad concept of health. It's physical, emotional, and social well-being. So it's going to measure indicators that have to do with mortality, with healthy behaviors, smoking, but at the same time, it tells you how many physicians you have in your town. They count averages, and they count a bunch of social indicators like children's poverty or single mother households or attendance to college. And so they count those things and count also environmental issues like quality of water and quality of the air and things like that.
So talking about healthy behaviors, Ramon, what things are included in that category?
Well, it's many things that have to do with living a healthy life. For example, keeping your weight down, walking, physical activities, not smoking, and whenever it's these intimate relationships, really having healthy practices in intimate relationships. Those are some of the top healthy behaviors that we talk about.
And then the clinical care, you mentioned that there's some factors on there about the physicians in our community. Is that the clinical care section?
Yeah, actually we do pretty good in some of those indicators. It's like, for example, we rank very high and we beat the national benchmark in the number of physicians and the number of dentists per groups of people here in Wake County. Those are very good, and that's kind of thanks to the private community that help us with that indicator.
One of the other indicators is the social and economic factors. And there's been a lot of human services programs focused very specifically on those things. How are those things making a difference here?
This is what is called now, if you look at something called Healthy People 2020, this is kind of the national guide for public health in the country. They targeting right now what is called social determinants of health, because they have realized that poverty or not attending college or unemployment are social factors that influence health conditions. So this is called healthy social determinants of health. And when you look at some of the things that are there, like children poverty, well, there's been a lot of activities, like we have human capital development programs. We're trying to move people to the middle class in the Middle Class Express. The county commissioners have been very excited about this one, so are many partners in the community are helping. That helps improve the social conditions of the county. And then, you know, Sarah, this is a very intellectual county. This is actually one of the most, it's been ranked as one of the most intelligent counties of the country because the number of college graduates that we have here. So we have we go above the national benchmark in how many people have a college degree or attend college. This is a privilege here that help us also with the rankings.
The last category is the physical environment, and you said earlier something about recreational facilities.
Yes, yeah, we got good rankings in access to recreational facilities, and also we're above the state average in access to healthy foods. We still have to do better in some of those healthy food issues, and then the other matter is that because we are a metropolitan county now, we have a lot of traffic, so that's affecting a little bit the quality of air.
A lot of these things, a lot of the programs that are happening in human services rely strongly on partnerships. Are some of the partnerships out there also contributing to this great health ranking?
Well, I really have to say, I know people have been congratulating me and my department, but this is not only us, this is an orchestra, as I call it. It's really a great orchestra in Wake County. We have 4 amazing hospitals that work very closely with us. We have a great coalition in health that is called AHA, which is Advocates for Health in Action. We have the pleasure of having John Rex Endowment, a health foundation that many people don't have a health foundation in their county. So that's a blessing. We have a great school system that helps us with graduation rates. So I will say, Sarah, we kind of groupies. We like, the covenant. It's like a covenant, and together we make it better.
Thank you, Ramon. We'll have you back very soon.